you for coming to our program today. I'm Christina, and I work for the Department of Lifelong Learning here at the Los Angeles Public Library. This information session is in support of the library's Health Matters programming, and is brought to you by LEPL and Community Health Initiative. I would like to welcome you to today's program on how Covered California can be more affordable and convenient for you and your family. Today's speaker is David Godinez, a health access specialist with Community Health Initiative. We are very delighted to have David with us today. He has a lot of great information. So without further ado, David, please take it away. Thank you for being here.
Thank you, Christina. Appreciate you working together to make this possible for folks out there in the community and whoever is seeing this. I hope that you learn as much as I've learned in preparing for this, and also just learning it for myself. I know it can be a lot of information, and at first I was kind of not scared, but kind of like overwhelmed a little bit. But I think this information can be beneficial to everybody, and I hope folks take from it as much as I take from it also. So basically what we're going to do is we're going to go over a little bit about the American Rescue Plan. As you can see here on my screen, it's fairly straightforward. We'll be learning about the American Rescue Plan, or ARP for short. So a lot of times you'll hear me just use ARP or American Rescue Plan. So we'll go over a little bit about the background. We'll go over some of the information regarding California and the American Rescue Plan and how they work together. We also do a brief review of the different levels of coverage, then followed by how does the ARP benefit your family and yourselves. How do I qualify? So how do folks qualify, and what do they need to bring, or what do you all need to bring? And why is it important to have insurance? We'll go over a couple of things on why it's important for you and your family, and talk a little bit about why I think it's important in my personal life. And then the most important thing I feel that most people want to know is, where can you go for support? So where can I go for support? Who can I reach out to? Are there any resources out there? Are there any specific people that I can go to? Are there any organizations that I can go to? Okay, so I'll just give us a couple more seconds for folks to keep on joining in. And once we begin, there will be some opportunities where maybe a question pops up, and maybe you have a question. But also, I will have do my best to answer anything that I can. So without further ado, we will start our next part of our presentation. So the American Rescue Plan. What is the American Rescue Plan? It's a plan. This American Rescue Plan was signed in March 11, 2021, a couple months ago, about 6 months ago. It is a $1.9 trillion bill in response to the ongoing COVID-19 pandemic. As you all know, we're still going through this thing called COVID-19 pandemic. So there are a lot of things that are going on, not just with health industry, but also in terms of employment, family, things like that. So this bill provides more than $3 billion to help lower the monthly cost of health insurance. And these $3 billion goes to help you, the citizens and residents of our nation, so that it can be more affordable for you. Maybe you know a little bit about the American Rescue Plan. I think one of the main things that everybody knows is the stimulus checks. While those are great, and I know they help me a lot, there's a little bit more to it. So they're going to take some time to talk about a little bit more. There was also the $300 added weekly benefits for unemployment. For myself, I was unfortunately, let go from my job. And I know a lot of us have had that experience. But one of the things that helped me and that helped a lot of folks out there in the nation is the $300 added weekly. There also is providing a financial help for coverage in the forms of subsidies. So the way I look at subsidies is basically financial help, money given to you to help you purchase your health insurance. And they also, one benefit of this is help extended COBRA coverage for 6 months up until September, so up until this month. And I'll talk a little bit more about COBRA coverage in just a moment so that we can understand a little bit more about what that is. So Covered California and the American Rescue Plan, what are the benefits? So we'll go over a little bit more about what are some of the, the benefits that help residents of California. And there are about 2.5 million California residents who are either uninsured or have coverage directly with insurance plans. So that means reaching out straight to either Molina, LA Care, HealthNet, Oscar, Kaiser, Blue Cross, and there's many others out there. And maybe you have a different one. So these are the plans that are available. So there are also about 110 California residents who are uninsured or didn't qualify for Covered California before. Maybe this has affected you, and maybe before you didn't qualify, but there is a possibility that now you do qualify. So as I mentioned, some of the plans available through Covered California are partnered with Covered California, are Molina Healthcare. We have LA Care Health right here in Los Angeles, HealthNet, Oscar Healthcare, Kaiser, Blue Shield, and Blue Cross. So one of the main benefits is there's financial help available through December 2022. So not only was this bill passed for 2021, they also given a lot more help for the next year. And I know that that'll help myself, help a lot of my family members, friends. So I hope if you are looking at this, that you also see that it's not just for the rest of this year, that they have extended it. So the options are there for you. And the way that you receive this subsidies or this financial help, the way you qualify or where can you go to qualify is through Covered California. And in the next slide, we'll talk a little bit more about Covered California. So Covered California and the levels of coverage. So the place where you go to find a quote for Covered California and apply to Covered California is coveredcalifornia.com or coveredca.com. And this is an online portal created and managed by the state of California, which means that the state of California is the one or are the ones who run the website and add everything that you would need to know about Covered California and the plans available. And this is where they connect to brand name health insurance. So some of the ones that I mentioned earlier, Kaiser, Molina, LA Care, they have these insurance organizations have come together with Covered California or the state of California to work together to make it easier, simpler, and more financially ready for or available for you. So there are a couple of levels of coverage, and I listed them down in the order of percentages of coverage. And I can talk a little bit more about what those percentages mean. I'll give some examples, but I want to make sure that everybody knows these examples are not necessarily the numbers that are available, or these are the numbers that, if I say a number, that this is the number that is that will be on the Covered California applications. I just want to make it a little bit more relatable and a little bit more understandable for everyone. So these coverages are the bronze 60%, which offers 60% coverage. There's the silver 70%, 70% coverage, the gold 80% for 80% coverage, and the platinum 90% coverage. So each of these tiers have a different levels or different ways of providing you with those benefits. But I will say that whether you choose Kaiser 60% or LA Care 60%, the plan benefits are basically the same. They're the same. There's not one is better than the other. they kind of go by tiers, but I know some people have certain preferences. Maybe they heard about Kaiser before, and they've had Kaiser, or you have had Kaiser before, and this is the one you want to stay with. There's not really a difference between the Kaiser 60 and the LA Care 60. But as with everything, it's always up to you, the individual, and what you think is best for your family. So there are also some vision and dental plans that are offered to Covered California. Maybe not necessarily the same percentage of the coverage, but these coverages are available for you and your family. So maybe you want to get the bronze 60%, but you really want to have the vision and dental coverage for whatever your needs are. There are the option to also select those coverages so that you can have them and be readily or have that opportunity to go to the dentist or get your vision checked. Maybe you need some new glasses and things like that. So those options are available. So there are also the enhanced health coverage benefits. So one of the great things that California has done in regards to working with the American Rescue Plan or receiving the help from American Rescue Plan are some enhanced coverages. And these coverages are the silver 73%, the silver 87%, and the silver 94%. And these plans are available for those who have received unemployment for the year 2021. And I would definitely recommend, if this applies to you, to look into Covered California and what benefits they have, because there are some plans that are as low as $1. So not all the plans are $1, but let's say an example, LA Care. I've helped a couple of folks who wanted LA Care and they had unemployment benefits. They were surprised that they were able to get a plan for as low as $1, but this is just some of the benefits that are out there. And some of these benefits, as you can see, the silver 94, when we compare it to the silver 70%, there is a lot more coverage. So there's a lot more help for you and your family. And so Covered California, as I mentioned, they provide the subsidies or the financial help to individuals and their families, such as yourselves. So these Covered California has worked together with a lot of folks to bring the best possible benefits and coverage to make our healthcare more affordable for you and your family and friends. Anyone who might be a resident of California, this is meant to help you so that you can be more affordable. As I mentioned many times, and I will continue doing that because I think it's very important for people to understand, for you all to understand, is that there is the financial help. So the subsidies. The subsidies, the way I look at it, is the reduction of consumers. So consumer being yourselves, the cost towards your premium, and a premium being the monthly amount a plan costs, or the monthly amount that you would pay towards having the coverage. It reduces that amount for you. And let me give you an example. Let's say Juan, his wife, Joanne, and their two kids, Salvador and Mary, they wanted to purchase a health insurance plan. And let's say that health insurance plan together for all of them would cost about $400 a month. I know for me, the $400 a month for having everybody on a plan can seem kind of costly and not necessarily benefit me and my family. But because of the American Rescue Plan through Covered California, that plan may go down to $280. So there's about a savings of $120. And remember, again, these are not exact numbers. These are just to make it more relatable to you and to myself and anybody who is watching this. Say what are the dollar amounts that I can potentially see, and so this is an example of that. And let's say with those $120 that you are saving monthly, you can use it for any other necessities of life. Let's say you recently had a newborn, and before we were struggling to provide diapers, and I know because I know children, newborns need a lot of diapers. Maybe you're putting off paying your car insurance because you just didn't have the means to pay it for that month. With this opportunity, you can now purchase that car insurance, purchase that food or those diapers for your children. Maybe your children in your family needed backpacks for school. Now you have that money that you would have used to pay for insurance. You can have your backpacks for and school supplies for your kids. And one of the main benefits there's the extended special enrollment period for Covered California this year. So normally the open enrollment period is from November 1st to January 31st, or is it 30th? I'm not sure whether January has 31st or 30th day. I believe it's 31st day. So those would be the normal or the regular open enrollment period, which basically means this is when you can choose to purchase or to select a Covered California plan. But for this year, it has been extended the whole year. I know I'm a little late in getting to that part, but we're still in October, November, so we have 2 more extra months, or you all had 2 more extra months to do a little bit more research, reach out to folks who can help you out with applying to Covered California. So who qualifies? Do you qualify? What will you need to qualify? And for Covered California, it is open to all citizens and residents at this time. So for single individuals who make less than $80,000, single individuals means you're not married, and when you do your income taxes, it means just yourself, non-married, who make less than $80,000. So the subsidy help is for those who make up to $80,000 who are single. For married couples, there is up to $160,000. So depending on where you are in between up to $160,000, you may qualify for subsidies. There is also what is called the head of a household who makes less than $120,000. And the way I like to think of heads of household are those folks who may not be married, but maybe are living with a significant other, or maybe they are taking care of family members. So that's the way I would describe heads of household. And the most important things in order to qualify, or what health insurance in Covered California take into account when trying to give you the amount of help that you need, or the coverage that you need, are your income, as I just mentioned, your family size. So those who have a bigger family size might get a little bit more subsidy help. But that is all just based on an individual case by case. The location. So where are you located? Maybe some plans are available in Northern California that are not available in Southern California, and the other way around. Maybe you live in Los Angeles. There might be certain health insurance plans that are not available in, let's say, Riverside County, but are available in LA County. And the biggest one is age. How old are you? And the younger you are, it's usually lets a health insurance know, okay, these are this person is usually more healthy, so they want to offer that to you. So age is a big factor. And I would just reach out to whoever you may be reaching out to help you to see how many of these qualifications, where do I stand in between all of them. Now we're going to continue a little bit more on who qualifies, what you will need to qualify, and I'm sorry, let me go back. So the way you qualify, the things you need to qualify are a proof of identity. So that can be your social security cards, photo IDs, passports. Some folks like to bring birth certificates just so that they're letting me know that they are who they say they are. There are the things that we'll definitely need to bring, as I mentioned before, and what they look at is income. So proof of income, pay stubs, tax returns that shows how many dependents you are claiming. Maybe you have unemployment and you want to take advantage of those enhanced benefits. There's the unemployment benefits letter. Some folks do receive those, and some of them have online. Bring on the online portion so that we can look it up, or someone can look it up with you. There are pensions. Maybe you're receiving pension because you're retired. We want to be able to have that information so that we can see what subsidies you qualify for. Social Security or retirement benefits. Maybe you're retired already, and you are receiving a certain amount of income every month from your retirement. Bring those along so that we can look at the qualifications for you. Maybe you are self-employed, you own a business. So we want to also have the Schedule SE or the Form 1040, bringing that form. And I know there are a lot of folks out there who don't receive a pay stub, or they don't get a paycheck, and instead they get paid cash. The way that we can go about that is through an affidavit, which basically is a statement signed by you or anyone in your family who's working, saying that you receive cash. So that way we can have that also as your qualifying thing. So there are a couple more things that we can use to say your proof of income. So I would recommend reaching out to whoever is helping you. If you want to reach out to myself, I'll have my information a little bit later or in a couple of slides so that we can talk a little bit more about that. And, oops, sorry. So okay, here we go. So why is it important that you have health insurance? So someone might ask me, David, health insurance is not important. I don't need that. It's too costly. I'm very healthy. My family doesn't need it. Sometimes I've heard these comments, and they can be very valid comments, but my goal is to help them see what are maybe some of the negative things, or not negative, but some of the things that can happen when you don't have health insurance. So for me, it's kind of like a risk reward situation. So I do my best to try to educate and bring all the information to folks. So one of them, we can start off with unexpected health issues. So as we all know, something going around is the coronavirus. So a lot of folks have caught the coronavirus. So this is an unexpected health issue that a lot of folks out there, a lot of citizens, residents, immigrants have had, or people all over the world in general have had this experience where there's an unexpected health issue. These unexpected health issues, maybe you hurt yourself and you broke a leg or something, and you're putting off going to the doctor because you didn't want to have to pay whatever they might charge you for looking at your foot, putting your cast on you, giving you medications or prescriptions to take away some of the pain. Some of these health issues are unexpected. Maybe you got in a car crash and you put off going to the doctor, and you really need to, but you don't want to, because the bills that you may receive are going to be very costly, and maybe you're not working at the moment. So these unexpected health issues can have a big impact on you and your family and friends also. In my opinion, and I'd rather have health insurance and not need it than not have no health insurance and need it. And I know for some folks that applies to them too. So I just encourage you to think about that also. I've had a lot of folks come to me and say, "Hey, David, this doesn't apply to me. Health insurance doesn't apply to me. I'm very healthy. I've in all my life, I've never been to the doctor. I've never had to go to the hospital." And I want to say kudos for to those who that they haven't had to go to the hospital, taking care of themselves, or maybe it's just there hasn't been a need. But I would also just say, anything can happen at any moment, and I would want to be prepared. And it doesn't hurt to have just a little security on that. So financial security, as I just mentioned, financial, so money, uh, uh, cost of things. Let's say, the, as an example, you did catch COVID, and now you had to stay home, and you're not allowed to work from home. So not only are you missing out on uh, your paycheck every week, or I believe it's a 10-day quarantine at your house. Not only are you missing out on those 10 days of paid work, going to the doctor would also cost you whatever amount they're charging you or billing you for that help to get better. So not only are you missing out on work, there's also the extra bills that will come in through, and if you're not working, the bills that you're already paying or have to pay will go up. So there's a lot of that financial risk. You're betting that you're going to stay healthy, when in fact you can give yourself a little protection, so that if you do get sick, you know that you can go to the doctor to get better quicker, or not quicker, but there's more opportunities for you to get the help that you need, your health so your health can increase and get better. And excuse me one moment, I drink some water. There are also the health insurance benefits. So there are a lot of different health insurance benefits that go beyond just your going to the doctor and getting care. I know a lot of plans offer physical education class, or a physical classes where you can get your body moving. I know some offer dancing classes. Some health insurance offer healthy eating classes, where you can log on or go to their YouTube channel, and they have someone preparing a healthy meal that you can make for your family. I know I've seen some health insurance plans offer little health insurance benefits for their pets, for folks' pets. So let's say you needed your little dog to go and get checked real quick, but it could be a little costly. Some health insurance, they offer that extra help for you and your dog. Let's say that you needed to do a little bit more research on yourself, or for yourself, on physical exercises, stretches that may do at home, that you can do for yourself to help you, be a little bit more limber, be a little bit more active in your health decisions. There's a lot more health benefits or insurance benefits that are offered, that when you're applying or looking into them, read a little bit lower on the benefits and see what else they offer. Highly recommend that, because there's a lot of things that can be helpful and useful. And one thing that I will let you all know is preventative services. So what are preventative services? Preventative services are just services to prevent, as in the word, you from having anything come up. Preventative services, for, let's say, for women, you need your checkups, for your feminine, taking care of yourself, whatever that might be. Those preventive services can be at no cost to you. And it's as simple as going to your doctor or setting up an appointment and saying, I want to take advantage of these preventative services for X, Y, and Z. Let's say that in your family, there's a history of an example of a diabetes, and you just want to make sure that you're not at risk or at a higher risk of developing diabetes. You can go and ask your doctor, I want to look into, having my blood sugar looking at. I want to look into having my heart looked at, and because maybe there's history of heart issues in your family. It recommended to you all to just get those things checked out. So later in life, if those things do pop up, you've been doing what you needed to do so that it is not a bigger issue. And as I also mentioned, is checkups. They're the annual checkups, annual physicals. I mean, you haven't been to the doctor in a couple years. You've telling yourself, man, it's time to go, but you haven't gone. I would recommend, taking advantage of these services and these checkups. Let's see. So then, where can we go for support? So this is more towards the end of our presentation. Where can you go for support? And I have listed a couple places that you can go, a couple of organizations that are out there, and these are by no means everything out there. So I would recommend, reaching out, going on the internet, searching health insurance, applying for your family. There you can go to the county offices, the DPSS. They're there to help you and your family, whether it is through health insurance or Medi-Cal. You can also apply to there. You can go to licensed insurance agents that you can look up online. I know when I'm traveling on the bus, I see a lot of health insurance agents, advertising and things like that. I would recommend that if you do go to a licensed insurance agent, that you ask if they have a license. There are some folks out there, unfortunately, who don't have licenses and are offering services. So I would just double check just to make sure. We don't want you all going out there and then you get help and you find out that that's not the help that you wanted or needed. So I would recommend, just asking. It doesn't hurt to ask. Here in Los Angeles, and probably everywhere in the state of California, I always see the Covered California buildings. They have their sign that says Covered California, we can help you, or Covered California, we speak this languages and these languages. So going to Covered California buildings, they have their licensed folks there that can help you, even if you don't want to get the health insurance right then and there, and you just want to ask a couple questions. You can go ahead and go through there. You can go through the coveredcalifornia.com website, as I mentioned earlier and showed a little bit earlier. I didn't get too much into showing you what that website looks like, but when you log on the internet and you type out Covered California, I believe it should be the first thing or the first website that pops up, coveredcalifornia.com. You can also go to the LA Care Blue Shield Promise Health Plan Community Resource Centers, or lacare.org also. That is where I am located at the moment. We're open from 9 to 5. There are a lot of locations throughout LA County that you can go to and just reach out. Not only are there folks that can help you out with health insurance, they're also offer different classes, exercising classes. There are different events out there. This coming week or in the next couple of weeks, I know there's a flu vaccine that they're offering. So you can go to lacare.org, Family Resource Center, look at some of the programs that they have, other resources that are there for you. And they are open from 9 a.m. to 5 p.m., Monday through Friday. And you can also contact me, David Godinez, Health Access Specialist with Community Health Initiative. And we are at I am at the LA Care Blue Shield Promise Health Plan Resource Center. And my location is in Metro Los Angeles at 123 Southwestern Avenue, Los Angeles, California, 90006. As I put right here, there is my email and my phone number with the extension. You have any questions that you might have, and maybe I went a little bit too fast in this presentation, and you want to have a little bit more of a conversation with me pertaining to your individual situation or case or your individual family. So please reach out to me. There are also a lot of other as I mentioned, resource centers. There's one in Linwood. We have some in the valley in Pacoima, Palmdale. There's one opening, or one. There is one in Pomona, East Los Angeles. Some of my colleagues are all at these locations, and they are just as knowledgeable, if not more knowledgeable than me. So I would recommend reaching out to them, and just asking them, hey, you know what? I saw David on doing a presentation. Can you help me a little bit more? They're more than happy to help you with that. And again, if you feel more comfortable with just going to me, there's my email again, david@calchi.org, to my phone number with my extension. Please reach out. We're here to help you, and we want to make sure that you and your family also have the health insurance, so that we can, or you can all, be prepared and go to the doctor. Even if you haven't really gone to the doctor, I would take this as that sign that you were looking for, or that person to push you to go. Please go. It's better to reach out now and take care of things, or be proactive now, than to have to wait till later and realize, man, you could have done all these different other things to prevent your health from deteriorating. So I would recommend that. So, and now, that is the end of our presentation. I'll leave this up here on the board for you. If you want to take a picture, take a quick screenshot, I would recommend you do that. And feel free to reach out to me.
All right. Thank you, David. That's a lot of great information. And we got a comment that Melissa Hernandez also agreed. It's a great info. Before we move on, I think we have a couple questions, but before we move on, I wanted to mention that during the months of November, December, and January, Covered California certified enrollment counselors will be at select library branches. Actually, they're in person. They can answer questions and may even help with on-site enrollment if that's appropriate for that situation. To find schedules and locations, you can check our library's website, particularly lapl.org/events. David will actually be, I think, a few of our library branches in the Metro LA area during that time, November, December, and January. So you can say hi there. But yeah, please check our website to find the specific library branches and the specific schedule as well. So I guess I'll just move on to a couple questions. So is Covered California a 12-month commitment? If I choose a plan, do I have to keep that plan, or I guess maybe that healthcare provider the whole year?
So that's a very good question. And whoever asked that question, this is something that I've had folks ask me, because for some, it can be a little bit more of a financial commitment to stay with the plan for a full 12 years. So what I will say, and what I know, is there's not a 12-month commitment. You are not locked in. So let's say that you really needed that health insurance, and you can only pay, or you can only go do 3 months. It's one of your options is to keep it for those 3 months. But what I will say is, let's say you want to wait 2 months and try to get that insurance again, or that same plan again. There will be some back pay for the 2 months that you didn't have it. But that doesn't mean that you have to stay for the 12 months. And let's say you really only needed it for a certain amount of time. Go ahead, and I would recommend you do that, to have it when you need it. But yes, to answer the question, there's not a 12-month commitment. So you can choose month to month. If you make those payments, then you'll have that insurance for that month coming up.
Okay, awesome. Good to know. I think maybe there's one other. Are there any other programs available to the community that don't involve Covered California, such as for perhaps undocumented folks? If so, what are they, and where can they go?
Oh, this is a great question. I do have a lot of undocumented folks coming in and trying to have me help them with different insurance, and see how can they get covered. So there are a lot of programs out there. Here in Los Angeles, there is the My Health LA program. I like to recommend a lot of folks go there if they're having maybe some wage issues, or their income is a little bit low, and they're undocumented and don't qualify for some of these subsidies, I would go to My Health LA. I believe it's .com. So I like to recommend people go there, and they kind of just ask a little bit about your situation, your income, who you are, your family, and things like that. You can also go to the Department of Social Services, or lacounty.gov, and apply for Medi-Cal. I know here in California there are different laws that have been signed for folks to actually receive health insurance through Medi-Cal. So Medi-Cal is a great one. For some folks, it'll be emergency Medi-Cal, but I like to think that if I'm in an emergency and I need it, I have that coverage and I can go to a hospital, not have to worry about any big bills coming. There was recently a law passed that is in effect till next year for those folks who are undocumented 50 years old and older, where they can get full Medi-Cal benefits. It doesn't start until May of next year, but that is a good resource to start thinking about too in the future. And I believe there are the same kind of thing, but for those folks who are undocumented up to age 26 years old can qualify for full scope Medi-Cal. And I know through Covered California, there's a lot of those subsidies, but folks can also go directly to those health insurance plans. Some of the ones that I mentioned, Molina, HealthNet, Kaiser, LA Care, and apply to directly. There's not necessarily you have to be a citizen or resident. You can apply directly to them. It might be a little bit more on the expensive side, but that is still an option for folks.
Okay. Thank you. Those are good options to know about. And I don't see any new questions coming in. So I guess with that, unless do you have any parting words, David? Or
yes, I would. I just mentioned a lot of these laws that were enacted here in California. So I would recommend and encourage folks to reach out to the representatives, their local representatives, send letters to them, send letters to the mayors, to the city council, and let them know, what you expect or you want to see in your community. It's a great way to get the word out there and start being a little bit more civically engaged, so that we can have these plans, available for everybody. We can have a Medi-Cal for anybody that needs it. I would recommend doing that. And also don't be afraid to ask questions. I know a lot of folks, well, I'm not sure, who do I go to? Ask these questions. There are a lot of people out there who are willing and able to help. So look for these nonprofits, look for these organizations that maybe you see on a bus stop, reach out to them, and they will help you. And I guarantee, you won't be, you won't look back at them and say, man, why did I do that? You look back and say, man, I'm glad I took that and I asked those questions.
Yeah, there's always there's never a bad question. It's always worth it to ask. And that's why the library's here as well. So feel free to come to the library and to your local library branch. And the librarians and the staff there is always there to help you as well and help answer these type of questions as well, or find you, I guess, the right organization or referral to get you to that right answer. So so I encourage you, as David said, ask the questions, think it over, think what's best for you. And always come to good sources such as David and Community Health Initiative and the library to help you along that path. So awesome. Okay. Well, thank you once again, David, so much for taking the time and for all that great presentation and amazing information. I hope it was helpful to you guys. Thank you for tuning in for a little bit this afternoon. And with that said, have a great rest of your day, everybody, and see you guys next time.
Yeah, thank you, Christina. Have a great one, everybody.
Bye.
Hope to hear from you. Bye now.